At least 61 persons are said to have died from the outbreak of diphtheria in Kano State. Salma Suwaid, Kano Diphtheria Case Manager, spoke at a webinar organized by the Nigerian Center for Disease Control with the theme Diphtheria Outbreak in Nigeria, Vaccination Response. Diphtheria is a bacterial infection caused by the Cyanobacterium species that affects the nose, the throat, and sometimes skin of an individual. Some symptoms of diphtheria include fever, running nose, sore throat, cough, red eye, neck swelling, and difficulty in breathing. The Kano State government has confirmed the outbreak of diphtheria in 13 local government areas of the state. As of 20th of January 2023, there has been 100 suspected cases from 13 local government areas recorded. Joining us in the studio is Professor Abdusalami Nasidi, Officer of the Order of the Niger, Chairman, Rich Care Foundation, and former Executive Director, ECOWAS CDC, to discuss the issue around diphtheria outbreak in Nigeria. Good morning, Prof.
Good morning.
Good morning, and good morning, Nigerians.
And welcome back again. We were a bit worried at first that you were either going to contend with difficult cash or first casting getting to the office, so we are happy.
Absolutely true.
Yes, that you were able to navigate these two variables that has practically held everybody down in Nigeria, regardless of your status.
Thank you very much.
We're discussing diphtheria. It has claimed a lot of lives in Nigeria, and for a lot of us, the question was, what if diphtheria again? We had just come out from a COVID era where we lost quite a number of our citizens, in addition to all other difficulties that we have been sustaining, and then suddenly from nowhere, we are now seeing a different kind of ailment with a strange name, perhaps, claiming so many lives and now spreading to as much as 13 local government in Kano. Can you help our readers understand what this illness is?
Well, thank you, and thank you again for having me. You've helped me a lot. You've mentioned the symptoms, the signs, and this is just for me to enlighten more about the disease. It's a bacterial infection, caused by a very interesting bacteria that produces toxin. So the bacteria, affects the cells, the body, and also the toxin it produces, also, affects the cells of the target organs it's affecting to cause the symptoms. So what is it? It's actually a disease that affects mostly children, and the most affected in areas that are not vaccinated are usually children aged between 2 to 14, but 80% of them will be below 5, and that's why the childhood immunization includes this vaccine that will assist in preventing it. So it's easily preventable. If there's a full immunization, the community will never experience diphtheria again. So seeing diphtheria in any community or any country is definitely a sign of vaccination failure. That means there's a problem with the immunization program of that country or that community. And as you might be aware, we have been having problem with getting our children fully immunized. Some due to the behavior of the communities, some because of the civil strifes, wars, and banditries. So the immunization teams can reach some of the communities, and some, also the health sector failure. I mean, we have some blames too. We can take it away. So countries or communities that have 80% immunized children, not even 100%, will never see diphtheria again. So when we started seeing the symptom of diphtheria coming up in some states in the country, it became very worrying. The first was in the 2011, where we had diphtheria reported in Borno State. That is understandable because of the Boko Haram. And but what frightened us that time was that the case fatality rate was very high, 21 point something %. So that shows that there is the outbreak, and we don't have the means to mitigate the impact of that outbreak. So the outbreak affected the community and killed so many children. Can you imagine if 21% out of 100 are dying? In children, can you imagine a lady giving birth to a child, bringing a family, bring out the child, and it's now about 5, 6, 7 to 8, a beautiful period that families enjoy their children, and this disease comes and take them away. So that means there was vaccination failure in that community in Borno State, and then we didn't have what it takes to treat or prevent the effect of that toxin that kills people. So how does, how is the disease transmitted? That's easy. You mentioned it already. Any child, any place, or any carrier of this bacteria, that has symptoms in any community or any family will definitely transmit to another person. So either through body contact or through the body fluid or through the sneezing, droplets and etc. or any of the, if it's a child, the four mites that toys they are using. If another child comes to use it also, they will also get the disease. Okay. So why are we worried that we're having diphtheria now? It's not a new disease. It's not a strange disease. It's a known disease, but strange enough that is coming now, telling us that our immunization program is either not working, or I'm even suspecting, as somebody that is working in this area, that it could be that we have vaccine failure. Maybe the vaccines we are using too is not working now. So there are so many factors we are looking into.
All right, doctor. Now, so far, the infection has actually been confirmed in some states like Kano, Yobe, Lagos, Osun, and Katsina states. Now, what's actually being done to stop it from becoming a pandemic?
Well, pandemic is not possible because pandemic has to affect several countries. Okay. Epidemic is already an epidemic because it has affected so far 9 states in the country, with 5 states confirmed cases, but 9 states are already reporting cases, which is very unfortunate. But the worrying, as you rightly said, if the states with the largest population are affected, you mentioned Kano, you mentioned Lagos, that's very worrying. So we have to quickly, do whatever we can to interrupt the transmission, and how do you do it is to quickly, increase our vaccination of the unreached, and then also to get the drugs and antitoxins you need to treat those who are infected.
So, Prof, from what you're seeing and from the number of people we have already lost and the level at which this is spreading, it does appear that politics has sort of shifted our attentions away from so many important things. But are you seeing adequate and sufficient response from state actors, the governors, the primary healthcare development agency, and all those who should be responsible in stopping this spread on its track?
Well, I'm happy you are expert in language. You use the right language. Is there any adequate response? There is a response, but it's not adequate. And that's why up to today, we have not interrupted the transmission. As I'm talking to you today, new daily cases are seen in hospitals in Kano and these other new states, particularly in Kano. Almost 80 to 85% of all the cases so far in the country are reported from Kano State. So unfortunately, the political activities and whatever, those who are supposed to take decisions in how to curtail this don't even have time for what do they call it. But nevertheless, we have to praise the healthcare workers of these states and some of the partners that are working with them, to do the maximum they are doing to reduce the impact of the outbreak, that as compared to the Borno outbreak, where you have 21% case fatality rate, here now even still spreading and is bad, but at least we have about 10 to 12% case fatality rate, which means some efforts are yielding results, but not enough. By now, the Commissioner of Health of Kano State officially acknowledged diphtheria outbreak in January 2023. And now we are in March, and it's going, daily cases are still not reducing. So tell me, is the response really effective? It's not very effective. Something has to be done more. That means we need more efforts. And I think I should also say we shouldn't be relying on government all the time. You know, we Kano indigenes, we call ourselves concerned citizens. We are working very hard, you know, with all the, our good Samaritans to come together to assist, you know, to
when you talk about this assistance,
yes,
is it in terms of drugs? Because my question really in that regards would be, how can the communities, the affected communities themselves, organize, come together and organize themselves to prevent further spread? Especially because these children have to go to school, so you can't necessarily stop them from coming together.
I'm coming to that.
Yes.
You're right. So what I'm saying is, what do we do? You ask for the government first, and I said the government alone can't do it. So we have to have this partnership now, like we did with Ebola, we did with COVID. You know, so we are mobilizing. We kind of indigenous that can say, look, this thing is happening. There are days that, you know, you need the antitoxin to neutralize the toxins that is killing the children. But there are days that the antitoxins are not available. So the ones that government brought is not enough. It finishes in 2-3 days before they bring another one. So we have a problem of availability, affordability. So it's not available because we don't manufacture locally. So it is important for us to start seeing how we can do to manufacture or import. To import, you need money. It's very expensive. And the government and partners are struggling to see how they will bring it. So, you know, what we are doing is we are working with our partners. We have already antitoxins which we develop, our group in Nigeria, against snake venom, against Ebola. So we are working with some partners in India and other places to also start thinking of getting this our own local antitoxin. This outbreak shows how important it is to be self-sufficient in these products. You don't have it, it comes, you see your child dying and the drug is not there. It's very bad and criminal. So that's why we're putting the effort. We're working now with the Minister of Health. He has given us approval. We're working with NAFDAC to see how we can fill the gap. The NCDC have been working effectively on the second question that we are talking. That is working with the communities, doing risk communication and letting them know that, you know, this disease is preventable and they can play a key role in this. And let me just tell you something. Among those that have so far been recorded, only 18% were fully immunized. You can imagine how terrible it is. So I went to the wards in the hospital in Kano, and I found almost 60-70% of the cases there are zero immunized. So it's really embarrassing and very terrible. So we keep asking, why is the effectiveness of the immunization program? Is it because, you know, there are no vaccines or something? There are vaccines. What's happening? We have to really think of this. And now, what the communities themselves can do is that risk communication. And this is what usually affects immunization. If some of them agree to get their children immunized, then they see that in the community many children are dying from preventable disease. They say, you ask us to bring our children, we brought their immunized. Now they've grown to 2, 3, 5 years, they are dying. So that risk communication, in convincing the community more to say, listen, you can do much. Isolate the children. Make sure that, you know, anytime you see these signs you mentioned, running nose, difficulty to swallow, difficulty in breath, you know, changing voices, you know, those plaques you have been showing, you know, in the throat, and so on and so forth, they should immediately, don't waste time, they take the child to the hospital, because any child that has the disease that is taken to the hospital within the first 3 days, if they give appropriate treatment, could survive. Then secondly, you know, is actually getting the local things that can help to improve the well-being of the infected. That if a child is having sore throat, you know, with these plaques that are shown us, they can't swallow, they can't drink, eat food, they can't listen, and so on and so forth. There are some traditional, you know, medicines that can help to improve this inhalation and others, etc. You know, there are so many other things that they can take to reduce the pain. You know, even the Panadol, etc. before coming to the hospital.
Okay, now you've actually talked about, you know, children, you know, a lot, but what about the adults? Is it as fatal on the adults as it is, you know, children?
That is a very interesting question you are asking. What we are seeing now and what is shocking us is the fact that, you know, in the last 3 to 4 weeks, you know, the outbreak, as you call it, you know, epidemic is now affecting, there's a shift to the right, as we say. Instead of affecting more children aged between 2 to 5, 6, 7, 8, it's now affecting more children above 14 and entering adult population. And unfortunately, the peak of this outbreak, the fatality rate, those who died, are more among children that are above the age of 11, 12, and 14. So God has a way of protecting this, and the children lower die less. But if any child between 10 to that 14 is infected, the chance that they will die is more. But this strange phenomenon that the disease now is pushing more into the adult population is something that is worrying also. And
Prof, at your level and the places where you have functioned, you'll be privileged to know if we have received any international assistance in this regard. You have clearly said the vaccines are now available, and importing them will cost some money. Have we seen some of our international partners sort of show interest in providing any kind of support to help us contend with this?
Yes, as usual, we have our key partners, especially in all these disease and public health activities. The WHO is active on the field with the Nigerian Center for Disease Control, UNICEF. This is they even prime this is to protect the children, and of course we have now MSF. They are there on ground, and there are so many other partners from the USAID, DFID. But these three are the main partners now on the field: WHO, UNICEF, and MSF. So they are working with the NCDC, the state ministries of health, working very hard to reach out to those communities and increase immunization. But the problem now is we have to change our tactics, because if you are immunizing only the children and that are the target children to be immunized, and then the disease is spreading more into older age, then we have to think of how to change our tactics. The NCDC had a webinar, a very interesting webinar, and they discussed this issue. I'm very sure that they will change the tactics so that we can interrupt the transmission, because so far the bacteria is still spreading.
Okay, so sorry, talking about the bacteria still spreading now, there seems to be a new twist, because experts have actually said that they found a manifestation of diphtheria in female genitalia. I don't know what's that all about. If you could enlighten us on that.
Yeah, there are two types of the diphtheria.
Okay.
And I'm happy the one that is called the classical one is the one that has all those symptoms, say running nose, this, and difficulty in breathing, difficulty in etc. and so on and so forth. So that one ends up actually in a serious complications. It will end up targeting 3 organs of the body. This classical one, to target the kidney, target the heart, and target the brain, the nervous system. And some of those who die twitching at times, they have nervous problem. So if it is the kidney that is affected, it really shuts down the kidney. It's a toxin. So it's a terrible dissonance and so forth. So, and you can't believe it, some of them die of heart attack, because the toxin affects the
blood cycle,
the heart system, the platelets, and so on and so forth. So what was this thing you said again?
Okay, the manifestation,
manifestation of.
They're talking about the 2 types.
Yeah. So this is the classical one that I've talked about. Then the cutaneous one, I mean the one that is the skin one, it comes with rashes and symptoms and this and affects especially female. If there are rashes and it goes to the private part, people will think it's STD and all this. But that cutaneous one affects mostly the skins, the cells of the mouth and the nose, and so on and so forth. So if it goes into the genitals, it will manifest as if it is, an
STD.
An STD, and so on and so forth. So it is right. Some scientists are saying it can be spread sexually and all this in etc. So, but we think it is because it affects the skin, all those membranes, and if it goes to the genitalia, it will present as if it's an STD.
You said something that stuck with me somewhere in the course of your explanation, which was about vaccine security. when the Ebola happened, we saw when the COVID-19 happened, because it was a pandemic, we saw the way the world reacted, especially at some point when it became clear that some drugs could be effective against this. Countries started preventing exports of those drugs, and it felt like people who didn't have capacity to do anything were left to their fate. Thankfully, maybe I'm not sure whether it's the record or we didn't suffer as much casualty as we have seen in places like China and Italy, or even the United States. How important is it that we begin to rethink our entire health architecture? At some point, I remember 1 or 2 companies in Nigeria made efforts to get approval to become vaccine manufacturers in this country. Is that conversation still on the table? Have we just seasoned it because we are out of that pandemic in a way and waiting for the next disaster to happen before we start eating? What do we need to do, considering a population with a size like ours, and that we are sitting in a sub-region where most of our neighbors are really very poor, and a simple outbreak from that place could permeate our borders and become a problem for us? What do we need to do to get ready for times like this?
Actually, I'm happy that the last part of your question is one that even puts more responsibility on our head. That most of our neighbors are poorer and they're looking up to us. They're actually looking up to us to see if we can provide this solution. We had vaccine manufacturing before, it crashed, and that's some topic for the next another time. Then when the COVID was coming, we had series of interviews between the experts, Tomori, myself, others from the Ministry of Health, one of the questions I raised was we should quickly start making efforts to have our own vaccine. We should not rely on donor vaccine when they will donate to you. And some people say, no, the donors, they will give us, they will bring the vaccine. And I say, you can't rely on them, because they will not, if the disease spreads and becomes too dangerous, they won't release that vaccine for you if their own taxpayers are not fully immunized. And that is exactly what happened. So it just brought to the fact that we have no option but, as a country with large population, to start thinking of self-sufficiency. And that is why we have been on it for the past 20-25 years. How Nigeria should start vaccine manufacturing. There's a company established as public-private partnership, we call the Bio Vaccines, etc. And efforts have been made to see how it will take off. It will go, and then there's a delay, as usual in Nigeria. Some policy, somersault, whatever, all sorts of things have been affecting that our initiative and effort to get vaccine manufacturing started. Now we are talking of vaccine manufacturing. Vaccine manufacturing was much easier before. Now it has become so complicated. It's very expensive now, venture. But we have no option. We have to do it, whether we like it or not. But producing these antitoxins, like snake bite. If I tell you the states in Nigeria with big problem of snake bite, you'll be shocked. Where at times you go to those areas, you are talking of big public health problems like HIV/AIDS, your TB. When you finish, they will tell you, please, thank you for your big grammar. Our major problem here is snake bite. It happened to me in Kaltungo, it happened to me in other states, and so on and so forth. So if we hadn't risked our lives to challenge the snakes, grab them, get them, and produce the antivenom, we wouldn't have had our own antivenom. We would be relying, and people would be just dying from these preventable deaths.
Well, thank you so much, Professor. But this is where we actually wrap up this discussion. Thank you so much for joining us in the studio to enlighten us about diphtheria. Thank you so much.
Thank you, my pleasure.